Hi, I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions, and in this video, I'm explaining what to expect during a hearing test in our clinic. Not all hearing tests are created equal. Some hearing tests are very basic, and other hearing tests are extremely thorough. For instance, you may remember getting your hearing tested back when you were in grade school. This basic form of hearing test only evaluated your ability to hear beeps. Other hearing tests, like ones that you may receive if you report hearing difficulty, are much more in-depth and would evaluate your entire auditory system. This is what we would call a comprehensive hearing evaluation. The process of human hearing involves three different parts of your ear: your outer ear, your middle ear, and your inner ear, as well as your auditory nerve up to your auditory cortex inside of your brain. During a comprehensive hearing evaluation, every part of your auditory system needs to be evaluated. So let's break down the 8 different tests that you would receive to evaluate your entire auditory system. First would be otoscopy. Otoscopy is when we look inside of your ears to ensure that nothing is blocking sound from entering your ear. This could include things such as an ear deformity, earwax buildup, or another foreign object preventing the vibration of sound from reaching your eardrum. If earwax or another foreign object was identified, we would remove it from your ear in order to move on to step number 2 of your hearing test, which is pure tone air conduction testing. This is where you go into a soundproof booth, you wear headphones or insert earphones, and click a button when you hear beeps. This tells us how loud sound needs to be before you can barely detect it when that sound has to pass through your outer ear, your middle ear, and your inner ear. Then we move on to test number 3, which is pure tone bone conduction testing. This is where instead of sending sound through your outer ear, middle ear, and inner ear like we did on the previous test, we instead put a bone oscillation device on your head to send the vibration of sound directly into your inner ear. Of course, you also listen for these beeps and click the button when you hear them. This helps us identify where your hearing loss is originating from, either your outer ear and middle ear or your inner ear. If we identify a difference between your air conduction thresholds and your bone conduction thresholds, we need to move on to test number 4, which is tympanometry. Tympanometry is a test where we push air into your ear canal to determine how much movement your eardrum has. This test can tell us a lot of different things, primarily whether or not you have an air pressure issue in your middle ear, a fluid issue, or even a perforation in your eardrum. If we identify any one of these things, it could require a medical referral. The 5th test is a speech reception threshold test. This is where you listen for 2-syllable words and you repeat those words out loud when you hear them. Now, these words are presented to you at softer and softer levels for us to identify how loud sound needs to be before you can barely hear it and understand it. This helps us identify how much difficulty you're having hearing and understanding soft talkers. The 6th test is word recognition score testing. This is when you listen to a series of single-syllable words and repeat them out loud, but these words stay at a fully audible level. This test helps us identify how clear speech is to you, considering the fact that hearing and understanding are 2 completely different things. Once we have a good understanding of your ability to clearly understand speech in a quiet situation, we then need to move on to speech and noise testing, which is test number 7. This is where you have to listen for sentences and repeat those sentences out loud, but there's escalating noise in the background as if you're in a noisy restaurant. The goal of this test is for us to identify how much separation of speech you need over the background noise before you can understand what someone is telling you in a noisy environment. This test is extremely important considering the fact that your ability to understand speech in quiet has nothing to do with your ability to understand speech in background noise. There's also an 8th test that might be included in a comprehensive hearing evaluation if you have tinnitus, which is otherwise known as ringing or buzzing in the ears. This test is called tinnitus pitch and intensity matching, and it helps us identify the center frequency of your tinnitus and how loud your tinnitus is. Once we have this information, we'll be better able to address any tinnitus concerns that you have in addition to your hearing loss. Once completed, these 8 different tests inside of a comprehensive hearing evaluation will allow us to diagnose the type of hearing loss that you have and consider what treatment options are available to you. At the completion of this testing, it is also very important for us to explain the results to you in a way that you can easily understand. This way you can actually know what's causing your hearing difficulty and what you can do about it. In most cases, a comprehensive hearing evaluation is just one part of our Applied 360 Discover consultation appointment. We developed our Applied 360 Discover consultation for the purpose of not only testing your hearing, but identifying where your hearing difficulties are and what your priorities are from a hearing perspective. This consultation also includes an in-depth investigation as to what hearing aids would be best for you to solve your hearing difficulties, and for us to educate you on our Applied 360 Fit treatment process. And there you go. Now you should have a really good understanding of what all the different types of hearing tests are and how they all fit inside of a comprehensive hearing evaluation.